Thanks for your company. In our first story, the Health Minister, Kweku Agyeman-Manu, says a recent report by his ministry indicates there are empty beds in some hospitals, contrary to reports of a no-bed crisis. He said government is committed to investing in the sector, hence the establishment of call centers in major referral centers to aid proper arrangements before patients arrive. It will be recalled that recently a 70-year-old man died after visiting 6 government hospitals and was turned away over the unavailability of beds. The minister was speaking on the Super Morning Show with Daniel Dadzi.
When we talk about emergency, it should be treated as such. Whether there are beds, whether there is no resources or whatever it is like. You can't sit down and look at your brother to die. I visited a hospital in Paris. Paris is far away in Europe, a developed system. At an AAE center of Charles de Gaulle Hospital, there were patients sitting in chairs like we are sitting here, taking blood infusion. That was emergency. And I don't see why, when there's an emergency, somebody should be turned away. You see, this was one of the challenges when I encountered, I talked about. It is correct that directives alone can't solve the problem. And it's unfortunate that this issue came up. The irony of it is that this particular matter, the 70-year-old man, went through almost all the types of facilities we have in our country. You know, we have about 5 different groupings that do service provision. Ghana Health Service is the largest. The Christian Health Associations, including the faith-based Islamic ones and others, right? We have the quasi-government institutions, things like the Commercial Bank Hospital, Senate Trust, and others. We have the private sector enclave, several of them providing health service, registered and accredited, and people with professional practice certificates in them.
Yeah.
This particular case started from a private facility. The understanding we have from our preliminary investigations is that that is where the man always attends clinic. Virtually, he was referred to Kolebu without a referral note, and they got to Kolebu and somebody saw them, even went through triaging. These are preliminary things that we have, uncovered. And they send the man away to a polyclinic. And the polyclinic, they send him away to somewhere else, to SNAIT, and then later on finally ended up in Lekma. So you see, from private facility to a quasi-government institution, to a public institutions, and then we ended up in Ghana Health Service facilities for death. What I said initially is that I wouldn't believe that they encountered semblance of a middle-class type of a professional even in the facility. I always said that probably people they were meeting were the very down, low-level sort of, how do I call it, professionals there. But then they should have consulted with the in-charges, either the nurse midwife or the doctor on call and things like that. But we have set up a committee looking at what actually happened for us to know how we can address the matter. We don't want to rush to do certain things that might be changing as we move forward. So we're doing a comprehensive, holistic assessment of the matter, and I believe soon the committee will present a report. Apart from this, almost all the facilities that they encountered, Ghana Health Service has set up a committee investigating. Kolebu is looking at what they can bring to us. The private facilities we encounter in the association, and when we get all these things and assimilate them, we know what it is that we're going to do.
Right.
Immediately, what we said, and I even said that earlier, only the preparations were a bit not very fast. We're setting up a call center that will engage patients and the general public to give us information on things happening in the facilities, because the minister and his deputies and even the chief director of the ministry cannot be everywhere all the time. And since we have massive amounts of these points and stations where we treat people, it will be very, very challenging for us to think that we can monitor and supervise all of them at the same time. So when we get a window through which patients and the public can talk to us, we might be solving some part of the problem. But we are not waiting on the committee's report. We've started working on how quickly we can expand the call center facility we have with health insurance and see how we can put people in there to take calls from us.
So the purpose of this call center would be sort of to take feedback from patients?
We want to engage patients. We want to create a window where patients can talk to the center. And we'll sift through and see if we can do troubleshooting and things like that. Last night, for example, I was in the office in the day, around 10:30 when I was going home. I got a late call. And somebody was calling me from Kumasi about Manshia South Hospital, where there was an emergency. Somebody has been there for nearly 2 hours. There was no doctor, nobody seen to them. And that person told me they have called the Ghana Health Service Director General, and he said he was going to make investigations and things like that. Then I said, if you have complained to him, let it end there, and in the morning, I'll find out what happened in Manshia. So from time to time, you get some of these challenges, but how many people can access and reach the minister? And especially late night like that, 10:30, 11 o'clock, it can be challenging. And, you know, ill health cuts across 24 hours. All the time, somebody is being rushed to a facility. So we're working on that, and we'll see how best we can improve on the system.
Yes, so that has to do with that particular case where the committees have been set up. But you said that there's no bed crisis is an old issue. So is government doing anything to address the issue holistically by increasing the number of beds and introducing a number of interventions?
I wish we'll have waited a little bit to see what the committee will come up. I keep on mentioning and hammering on this idea of preliminary investigations. There is a report done in the ministry that indicates that at all times, 50% of hospital beds in totality are empty. And so they are trying to allocate a challenge to bed management issues and things like that. But I want us to wait and see what the report, when it comes out, will actually tell us. Government continues to invest into health sector. Both sides of the political divide. Expanding facilities, building new ones, equipping, retooling, maintenance, putting in people, doctors and nurses and things like that year on year, right? But a developing economy, just like our roads are not adequate, just like our schools are not adequate, just like so many things we haven't even completed fixing them. You wouldn't want to think that the health sector is an utopian land sitting in the middle of nowhere. So we also will face challenges just like all other sectors. And some of these things are problems. We need to do improvisation. We need to do with the little that we have and try to see how best we can optimize our service provision to give to the public what they deserve to take from the little resources that we have.
I'm curious about this issue of 50% of beds being available. Is that in every facility, or is that when you take all facilities together in totality?
When we take all facilities together in totality.
Okay.
That is what it says.
So that should mean that, for instance, there could be full hospitals in Accra, but somewhere in Tema or somewhere outside Accra would have available beds.
Right. In fact, there is a system already operating within Ghana Health Service and the teaching hospitals, saying that, like the patient who died at Kolebo, for example, it should have been the obligation of the person on charge, on duty there, to call other facilities to try to see if there is a bed sitting somewhere. I myself have encountered that where I come from. I have people, when I get home, I interact with. The hospital sitting there, when they do a referral to Konfanochi, for example, they will call Konfanochi to try to ensure that there is a bed there before an ambulance moves towards Konfanochi. For the last 2 months or so, some people were coming from my hometown to Accra. They were involved in an accident at Nkoko Hospital. The case of one of them should be referred to Konfanochi. They called Konfanochi. They were calling until late afternoon, around 4:30. Before they give them the go-ahead to bring a patient, because they will be able to create a bed for that person. So these things happen from time to time. That is the efficiency with which we work. But in particular cases, we don't see this type of efficiency in there. As a city, right? Ghana Health Service facilities in and around Accra and other cities, right? The doctors in there and their post staff are linked, saying that if there is an emergency and they want to push people elsewhere, they continue to do that. We are yet to link them with the tertiary facilities and the military and the police facilities to see how best we can synchronize this situation. But like I said, let us wait a little bit to see the committee's report.
When should we expect to see this linking being
around the first weekend in July. I think the Ghana Health Service report will come to us on the 7th. We have said it should cut it to 5th. And then we expect that between 8th and 9th, virtually around 10th of July, this report will come out. I have asked them to try to look at what recommendations will bring lasting solutions to some of these challenges we face within the health facilities.